I am James. I'm a nurse practitioner student at YSU, and I'm going to be doing a heart vessels and abdominal assessment on Brett here. We did his height and weight and his vital signs off camera, and that'll be seen in the charting. So any questions before we begin?
No, sir.
All right. So looking at Brett here, his skin is a normal color. He's white, no blotchy spots or anything. Hair is evenly distributed. Put your hands out like this for me. Just making sure everything looks good, like you're not having any cold spots or anything like that. So I'm going to go ahead and feel your carotid pulse on your right side here. That feels good, and the same thing over here. I'm going to feel your brachialis pulses on either side. And your radial pulses on both sides. All those were even and +2. I'm going to feel on your legs, I'm going to feel your popliteal pulses on both sides. I'm going to go down here and feel your post-tib on either side. I'm going to do those one at a time. Then on either foot, I want to feel your dorsalis pedis. And all that was even, +2, and equal both sides bilaterally. I think I've got everything with you sitting up. If you wouldn't mind just going ahead and lay down here. Awesome. Here, I'm going to try and keep you in the video. I did miss listening to your carotid pulses for Brewy, but I can do that while you're laying here, okay? Just listening with the bed of the stethoscope here on his carotid pulses. Not feeling any Brewy. Awesome. While I have this out, I'm going to go ahead and listen to the vessels in his abdomen here, as well as his abdomen for vowel sounds. Next, I'm going to go ahead and palpate his abdomen in all of the quadrants, and I'm going to start lightly, and then I'm going to go back around and go everything deep. I'm going to try and kind of stand off to the side here so you can still see where I'm feeling on the camera. I'm not feeling any abnormalities, no bumps or lumps or anything. I'm going to go back through all the quadrants and feel again deep. A lot of pressure here. Now you tell me if you feel any pain. Any discomfort. Okay. All right. Next, I'm going to feel his liver and make sure that he has a normal sized liver. I'm going to go ahead and feel up the right side underneath his ribs. I'm going to have him take a big deep breath when I hook underneath his ribs. So a lot of pressure on that right side, okay? All right, take a big deep breath. Breathe out. All right, good job. And then next, I'm going to feel for his gallbladder. Push up against me here. Perfect. And then lastly, I'm going to feel for any rebound tenderness to make sure his appendix feels okay. Everything feel okay with that? No pressure, no tenderness? Awesome. Next, I'm going to percuss everywhere in all of the quadrants and make sure everything has a normal sound, no abnormalities there. Lastly, I'm going to go ahead and go grab a pen, and I'm going to measure the size of his liver. So I'm going to start about the nipple line, mid-clavicular line on the right side, and I'm going to palpate down until it starts to sound different. I'm going to make a mark, and then I'm going to do the same on the way up, and then I'm going to measure that mark. It's about right there. I'm going to do the same thing from the bottom up. All right, then I'm going to go ahead and measure that. All right, that looks good. Next, I'm going to take the back of the reflex hammer and I'm going to run along the dermatomes of his stomach and make sure that all of the muscles contract as I run this along the dermatomes. All right, you can go ahead and sit up here. All right, I feel like I have hit everything, and you had no tenderness throughout. So with palpation of his abdomen, everything was normal. There were no abnormalities felt, and nothing listened to. All valve sounds were present. No bruise, listening to the arteries and the blood vessels. His pulses everywhere were great, +2 and equal bilaterally, and felt throughout. And then no abnormalities in skin color or appearance. All right? All right. So I did miss a couple things. While Brett's sitting here, I'm going to check in his distal extremities for edema. I'm going to check down here in your legs. I did check your arms while I was looking. And no edema there. And then last one, have you lay down here for me. I'm going to go ahead and take a look for his jugular vein distension. So go ahead and take a big look right for me. I'm just looking at your neck here, at your jugular veins. Take a look right for me. All right, good job. You can go ahead and sit up. All right. And that should be everything.